Welcome to the Awe and Wonder podcast. This series is about cultural responsiveness, and we're very excited for our guest today, who we'll introduce in just a minute. My name is Sarah Kinsella.
And I'm Brenda Del Monte.
And we're joined by Renaldo Fowler. Hi, Renaldo. Thanks for
Hi,
joining us
Lynn.
today.
Thank you.
Brenda, how do you know Renaldo? You're the one who got Renaldo on our podcast today, which we're really excited about. You want to give us a little background about?
Yes. So I'm in Arizona, and we have a conference that Arizona's ASTAP, or Arizona Technology Access Program, puts on with, I think there's a couple other acronyms that are probably really important that I don't remember. But anyways, this summer we were at a mutual conference together, and I was there representing the nonprofit that works with kids with significant physical disabilities. And I had the pleasure of meeting Renaldo, and we got to talking about the grave topic of, actually, Renaldo, I don't know if you remember, somehow we quickly went to CPS, where it was like, there are reported, the people with disabilities are reported pretty highly to CPS, partly because people don't understand disability. And then people that are African American also get reported for a CPS at a higher rate. And then the people that are African American with disability, it was like off the chart. And so we were talking about early intervention and or the home-based services, and how off-putting that is. And then recently, I think there was some research around African-American boys, I think age 7 or something, with disabilities were coming up really low on their skill sets. And it was partly because they'd missed out on some intervention prior to coming to school. And some of that was because the comfort level in that culture was not at they're not trusting that they can do early intervention services without being scrutinized to a point where they just don't feel like it's safe. And so how do we bridge the gap between what, the disability and the services that those people need, and the comfort level of the population that needs them? And so it was a fascinating conversation. He rattled off so many statistics. It was amazing. And I hope you have some of those at the tip of your tongue today too, because it was just like, that's what pretty much sparked this whole series for us. Is I was like, you know what? I feel like we are walking around like we don't think exists. We are walking around thinking we don't see color, or we were walking around thinking that all people with disability are equally discriminated against, which to some extent, all people with disability do experience some kind of inequitability pieces, for sure. But then there's above and beyond that as well. So your work was just is interesting. The reach of your work in your conferences is amazing. And I can't wait to hear more about all of that. So why don't you start by just telling us about your role and the community you serve?
Okay. Well, thank you, Brenda, and thank you, Sarah. My name is Renaldo Fowler. I work for the Arizona Center for Disability Law, which will soon to be Disability Rights Arizona. So Disability Rights Arizona is part of a national protection and advocacy system in the United States. So every state and territory have a protection and advocacy. So if you're in California, Disability Rights California, Disability Rights New York. So we're part of the Disability Rights family. And so I've been at this law firm for 4 decades. Okay, so I've been in the disability field for more than 4 decades. I started working at this law firm right after I graduated from Arizona State University. And so I've been here, and my original work was working in the area of special education. I've done that for many years. That's always close to my heart. And when I did a lot of work around special education, a lot of the students I worked with, they were students with more challenging behaviors, a lot of kids on the autism spectrum, kids with emotional disabilities, and a lot of those kids were kids of color. And I really started seeing early on that a lot of these kids of color were being disciplined harshly. A lot of them were being removed out of the education setting, placed in more restrictive setting, a lot of missed learning opportunities for these particular kids. So it's kind of a domino effect on these young kids. And so I started seeing a lot of that disparities in terms of discipline of kids of color. And also I saw it in terms of kids with low income. So you had kids from low wealth communities. You start seeing those numbers too for those kids. And so I would see these things going on. And so I did a lot of work around special education. and really start focusing on just trying to tamper down some of the discipline stuff here at our office. We really identified those issues. We start trying to address this issue at the state level and things of that nature. And you get into those complexities where people will use statistics to show that, well, we don't have disparity. Our statistics don't show us. And as you know, you can get a tool to give you any answer that you want to have, okay, and how you interpret that data. And so those are some of the things that I saw around, especially African American communities and communities of color. And so over the years, since I've been here, really we focus a lot at this law firm to make sure we address the needs of the underserved community. Arizona has a large Native community. So in the past, prior to COVID-19, we were out in various nations where Arizona is a border community with Mexico. So we have those border communities. We have large Native populations. And so we try to stay on top of things in terms of organizations. And so one of the things I really started noticing a great deal was when I would go to different events. I might be the speaker, it might be a statewide, county, municipal event, early intervention event, different conferences. I would not see a lot of African Americans at those events. I just would not see them. Especially if they were making policy, if there was a state agency or some agency making policy, county level, city level, around disabilities, I would not see African American families. So you have people developing policies without any input really from a community that they probably didn't have an understanding of the community. And as we know, I know people think it's this whole concept of diversity. Different communities, no matter where, if you live in the Appalachian Mountains, if you live in Oklahoma, Oregon, Seattle, California, we all have our little micro cultures of how we do things, right?
Right.
And that's the strength of America, not our weakness. And so you kind of have an understanding how to serve those communities, have a basic understanding of those communities. And so I would see not very many African Americans there, families, young moms, especially around early intervention, increase in autism. And so those are some of the things that I saw. And so one of the things that I thought was important is to start addressing these issues out in the community and trying to get some of these folks to, take a look and try to make some changes to the community, address the needs of the community, and things move slowly. So what could I do to try to improve this situation? Because it's crucial for kids with autism, get early intervention, or most kids with speech and language deficits or other deficits. Get them early when you have those learning stages. And
Yes.
if you don't, then you got behaviors coming into the school system, right? Then you're interfering with learning. And it's just more and more strikes against these kids. And so we're not just talking about over-identification. We're talking about over-identification and underserved. So there's a lot of things going on. So kids are over-identified, but they're also underserved when they're identified. So there's many different factors. And economics play a part in advocacy. A lot of the families who are middle income, upper income, have better resources, better education, have understand the system that was designed. They have time to take off for IEP needs. A lot of low-income families, jobs don't really give them opportunity to take off and things of that nature. So a friend of mine, we were sitting down and having lunch. Back up a little bit. Back in 2002, I was able to get some additional funds from Jean Fairfax, who's a philanthropist who passed away in the Phoenix area. She did a lot around student work, equity around education. So she funded one of our lawsuits, and we had some additional resources available. And so I approached her, wrote her a letter, and say, hey, can I use this money to try to get something together around African Americans with disabilities? And so that happened in 2002. And we had a really successful event at South Mountain Community College, which is a pillar of the community in South Phoenix. We had a great turnout. It was on a Saturday. I was able to get free food for everybody. And some of the students who were going to college that day dropped over and had a free meal. And
But they like that.
They dropped by and they were a little afraid. I said, no, the food's guys. And as long as you come by and listen a little bit, and they came out and they listened. So it was a very successful event. Pushing 10 years later, I was sitting down with a friend of mine who's an African-American gentleman who has a disability. We had to start this conversation. But hey, David, we're seeing the same thing. He said, well, let's do something about it. So David works for Ability 360 at that time, which is a independent living center. David said, well, maybe I can get the rooms. And I said, well, David, I can get some speakers. We put the first conference together in 3 weeks.
Wow.
3 weeks. Okay. And this year will be our 13th year. So it's almost over 12 years ago. We sat down, and remember, that's 10 years exactly after the original one that I put together. We sat
Right.
down, had lunch together, and we put the one together. And we called it the first African American Conference on Disability. We were pretty ambitious. We didn't have any money. We had box lunches and things of that nature, but we had a good turnout. So we start planning for the next conference. So over the last, I would say, I think for the first 9 years of the conference, we've grown from like 100 people to like 350 prior
Wow.
prior to the COVID pandemic. And so those 9 years prior to COVID, we had many workshops. We had workshops on occupational therapy, discipline, election, mental health. And the most interesting thing, it's the most comprehensive conference that addresses African Americans with disabilities in the United States.
And
Go ahead.
I'm sorry, will you tell us the name of the conference again?
So it's called the African American Conference on Disabilities.
Okay.
So there's some key things that with this conference. It's designed for the African American community and for those who serve the community and whoever wants to come to learn about, eliminating barriers. It's a very diverse conference. Our speakers are diverse. It's a grassroots type of conference. So prior to COVID-19, we had it at Desert Willow Conference Center, which is a nice conference center. And the full day conferences, we were charging like $95. So what we do is we get a bunch of sponsors, right? They help keep the cost down of the conference because it makes no sense when we're targeting families, we price them out, right?
Right.
And so we made sure through our sponsorship that we made sure that we have the price down where families can come to it, and we had scholarships. So we never turned a family away.
That's great.
All the time. Okay. So, and our topics, as I mentioned, cover special ed, cover all types of topics, right? All types. And we had speakers from across the United States come. And here's the beautiful thing about it is our speakers at the conference, the way we're able to keep the cost down, it's all in-kind services. Our speakers will travel from different places out the United States and do it in kind. Okay.
Wow.
Rarely have we paid. We helped, I think, a couple speakers travel with one of our partners. And remember, this is a partnership of different organizations. I'll talk a little bit more about the DD Network, the Arizona Commission for the Deaf and Hard of Hearing, our Institute for Human Development, and the Sonoran Center. These are our USET program and our DD planning councils. So we have some great partners with us to make this happen for families. So the nice thing about it, we have all these speakers who want to speak at the conference and waiving their fees because they know we're trying to do something to serve the community, right? So we were very successful. Then the pandemic hit. What did we do? Everything shut down. Our conference was in February of, I think, was it February of 20, I think, and March when they start shutting things down. Right? Shutting things down, right? We were like one of the last events at that conference center. So we had to decide when the next year come around, what do we do? How do we do virtual? Remember, that's the beginning of the new virtual platform, right? How do we do this? What do we do? And so, we could cancel it and say, well, let's try it at the pandemic. So we decided to say, oh, let's just do it virtual. The beautiful thing about it is we had great tech support from our Institute for Human Development in Northern Arizona University. Had a great tech team, great technology tech team, right?
Good time to have a good tech team during
the
pandemic.
They were there already in place. They had some
essential.
And also the University of Arizona Sonoran Center, which is our USET. We have two USETs in Arizona, University Centers for Excellence in Developmental Disabilities. We have two in Arizona, okay? Northern Arizona University and University of Arizona. They had great tech team. So we put our conference together, and the first conference, we made it free. We had to increase our Zoom capacity because that's when Zoom was new. We had to bump it up, Zoom capacity,
Sure.
and our technology people decided to do Facebook Live, right?
Hmm.
So this is kind of innovative stuff back then,
Yeah, you
right?
guys were on top of it.
Yeah, and at that time, Facebook wasn't really great accessible, so we had to work on that. We had that conference, virtual conference, and our we had and this was ambitious. We had the conference during the entire month of February, right? Because when we had the conference before the pandemic, it was held one day in February in honor kind of Black History Month. But we started to do, I think, a couple workshops a week for the whole month of February. That was exhausting. And we had ASL, we had CART, we had everything, right? We had over 11,000 people attend the conference.
Wow. That's
We had,
amazing.
yes, 11,000 people attend the conference. We had 32 universities from across the United States, from Harvard to California schools, New York schools.
Mm,
And the beautiful thing about it was, I think we had 15 countries participate in the conference.
wow. I mean, that just
Incredible
shows you
reach.
how
Yeah,
important this is to
it,
people. And yeah,
it,
not just because it's virtual, it's like
it was
this is
crazy. It was crazy. We had New Zealand, we had Kenya, we had Ethiopia, we had Hong Kong, we had a school in Poland. I think there were an OT speech and language special school. Students were following us in Poland. We had
neat.
Germany. We had all these different countries following us. Egypt, there's somebody in Egypt who all the workshops. We did
You
these
probably,
presentations. Go ahead,
I'm
Sarah.
sorry. I was just thinking you probably had more, I wonder if you had more families able to join because of the flexibility of allowed to be home, or do you
It
think?
was, I think what happened was it was virtual. Everybody
Mhm,
remember it was virtual and we didn't have a charge to it because we just
right,
didn't, it was new. So
right.
we didn't have a charge to it. So it was open, it was free. And so
Hmm.
what people found out was, wait a minute. And what's the most unique thing about the conference was, because Arizona has such a small African American population, I was getting a lot of inquiries from large urban areas saying, "Well, how you guys do um, this conference with such a small population?" And so I explained to everyone, I think I have one of the best teams that I work with putting this conference together. I do good portion of the work for the conference, but I have a great team of folks at um, our Institute for Human Development at Northern Arizona University. They also provide technology and they also present expertise. And we talk more about that. So they have staff that presents at the conference. Same thing with the University of Arizona Sonoran Center. Um, they're part of the planning committee and they also have staff at their school that participate at on the conference, and they help find the speakers for the conference. And so it's really a team process. And so we did that first one, and it was just, we had people all over the world. Facebook, I got an email from some students in a college in California. They asked could they attend, participate, at the conference and, do the remote thing while they look at the conference, have students study it. And so we did those things, and we had some really innovative workshops that we had at the conference. Our opening session, we had 1,300 people attend the opening session.
That's wonderful.
1,300 people.
Yeah.
And we only
So
had, go ahead.
it makes me wonder, what did you learn as other countries and other people, other states, other countries joined the conversation? Was there overarching similar issues in regardless of the country?
Mhm.
And was there overarching similar issues regardless of the state kind of things? Like what was consistent?
Well, let's talk about from a state perspective, from state to state. So the conference now has a Arizona national and international footprint. Okay.
Hmm.
So one of the things at Arizona level is a lot of the policymakers now come to the conference. they see the conference as an opportunity to learn, right? And it's for families to learn, right? And there's also it's a design that families talk directly with those policymakers, right? Then we have other states that takes a look at Arizona. Oh, Arizona's doing it. We should be able to do it with our numbers. And so you see that. Then at the international platform, last year we had several countries that attend the conference. And so when we're going back in person. Last year, I worked with 4 different African countries trying to get them past the visa process to get to the conference, but they found that information too late to get through the visa process. So the visa process for a lot of the African countries take months, half a year, versus our process is much quicker.
Okay.
So what I did was I got an email from several African countries saying, we can't make it this year, but when you find a location for next year, please let us know, especially the country of Malawi. The country of Malawi has just been pushing, trying to get to the conference. So I've sent many letters, I think 6 letters of invitation to different countries, Ethiopia, Kenya, and a few African countries. I'm trying to get them here because they want to reproduce the conference in their country, because now they're looking at disabilities, right? And looking at the platform that we're doing. And
Is
so
that
that's
because
important.
you're back to in person now? Excuse me for interrupting.
We're back. So last year, so we did 2 years virtual. Okay. So last year, what we did, so we did 2 years of virtual. Then what we decided to do was this year, in February, we went back. We went back. However, after the COVID pandemic, everything has gone up significantly high. So I moved the in-person conference to June to give me more time to raise money for June, right? But I didn't want to drop the virtual component because it was a very successful tool. So what we do now, the conference is 2 parts. It's one conference, but it has 2 parts. In honor of Black History Month, we do a virtual pre-conference, which is coming up February the 14th and 15th. We have that, and we'll do 2 workshops each day. So a total of 4, 2 on the 14th and 2 on the 15th. Then on June the 26th, we will have an in-person conference at the Hyatt Regency. Last one we just had, we had 450 people come to the conference, and our keynote speaker was our Secretary of State in Arizona, the Secretary of State, and also our governor, acting governor, when our governor's not here. He talked about voting, but we had a great turnout at the conference in terms of families, professional policymakers. So we had the conference, and so so we're back in person. So we did that in 2023. I am planning for 2024 now. As I mentioned to you, February the 14th, 2024, 14th, 15th, we have a virtual conference. We have those workshops already scheduled. Remember, I mentioned to you, we have a international platform. Well, one of our speakers, one of our partners called the Arizona Center for African American Resources, has been with us for many years, one of our partners. Dr. Dawson does a lot of work around trauma. Great speaker, does a lot of work around trauma. And Dr. Dawson has talked about trauma at the conference. The government of Kenya, she went over to Kenya last year, and based on the work of the conference, now she's doing work about trauma, and she did a presentation. And so she's going to talk about at the opening session of the conference on the 14th, what she did in Kenya and the threads that we have in the United States and in Kenya. We had slavery here, they had colonization there, and there is still issues around colonization. So you have these, some people don't even think about, we had slavery here, they had colonization, which was almost like slavery, right? So she's going to talk about that at the opening session of the conference. Our second session of that day, we have 2 a day, 1 in the morning, because we want to make sure that when we do the presentation in the morning, that our viewers in Africa, it won't be too late. I think it's like 6 or 7 at night. So we're doing that. And so she's going to do it. But our afternoon session is going to be about, what are healthcare providers' responsibilities to provide accommodations in terms of healthcare providers, doctors and therapists. And we're also going to be partnering with the Arizona Commission for the Deaf and Hard of Hearing. They're also going to be partners with that. And they're going to talk about resources that to help you as a professional healthcare provider, how to comply and what are the resources that's needed to meet the needs, specifically the deaf and hard of hearing. So
Yeah, that's great.
that's going to be the first day. Second day, our friends at the Sonora Center, University of Arizona, is working with a group of African professionals in Africa. And they're going to be presenting that morning. They're in Africa. They're going to be presenting about the work that they're doing around disabilities in Africa. So a large panel from different countries in Africa. That's going to be the opening session the second day. And the final session, fourth session, is going to be done by my coworker, Amanda Glass, who's going to look at discipline, because discipline is an issue around African-American kids still. And so that conference, pre-conference, is going to give you a little bit of taste. So we, as you can see, we do international, we do healthcare, we do education. So that's that's going to happen on the 14th and 15th. Then on June the 28th, we're going to be at the Hyatt Regency in downtown Phoenix with a full day of conferences. Last year, just to give you guys a heads up, we had an actual vaccination clinic at the conference that was open to the public. So even if you did not attend the conference, you could come up to the conference, and they had a variety of vaccinations, not just COVID. They had many types of vaccinations. It was, I think, Maricopa County Health Department was part of that process. And so we're looking to maybe do that again this year at the conference, maybe have vaccination clinic and maybe some health screening, maybe diabetes, maybe prostate, maybe cancer. I spoke to someone this morning, maybe breast cancer. So
many resources available.
Yeah, so many resources available. And so what we try to do at the conference is provide a lot of different topics to cover. Okay. This year we're working on, since I oversee our voting rights project at the law firm, that's one of my jobs too, is to work with all of our election officials, from the Secretary of State's office to the governor's office to our recorders, making sure that the electoral process is accessible for people with disabilities. So we're hoping to have some really great folks that I'm trying to finalize to be our lunch speakers to talk about voting and what they're going to do to make sure voting is accessible for people with disabilities. And also, when we think about people with disabilities, we're talking about our seniors. We're talking about our veterans, okay? Because a lot of times people forget a lot of our veterans are getting older. They have many service injuries. And so they need a support when they go vote. And our seniors who might be in nursing homes, what happens when the pandemic happens, okay? So we worked a lot with our recorders in Arizona to expand voting options for people who are in nursing homes through the special election boards. And so we do a lot of different things at the conference. It's open to anyone. It's the most diverse conference in Arizona. You know, the people always ask, well, what's the difference? The only thing that we do a little bit different is we market a little bit more to the community, but it's open to anyone. And one of the key things I think is important, the conference offers a safe space for African Americans and for those who serve the community to have a good conversation on equal ground. It's a safe place, okay, to have that brave conversation. And so one of the things that we do at the conference is we have those brave conversations. So often people don't feel uncomfortable. They don't want to have those brave conversations. So nothing ever gets done. Nothing ever gets done. So it's a place where, you know, African-American families can say to policymakers, why don't you guys come to our community? Or, you know, I'm reluctant to have you come into my home because I think you'd be judging me all the time. And if I let you into my home, I say something wrong, are you going to call, you know, Child Protective Services, you know, Department of Child Services on me because you don't like the way I do things, you know, or they may not feel that you respect. It's like anything in general. Most parents a lot of times feel that a lot of professionals don't listen to them because they don't have a PhD or have these credentials. And I always tell parents, yes, you have credentials. Your credentials is mom and dad. You're the PhD mom and dad, right? And so
you know, that there's two things you've said so far that were interesting. One, I mean, lots of things you've said were interesting, but two things I want to dive further in. Sorry to say it that way. One is that already a reoccurring theme in the conversations is parents of kids with disabilities not feeling like the quote experts are listening to them,
Mhm.
or that if a family feels like a little bit hesitant to ask questions because they don't want to look stupid, or
Mhm.
they don't want to look aggressive, which is
Mhm.
an interesting word. I don't think that I feel like that's not something I've ever thought of as a parent, like that if I ask a question, you might think I'm aggressive, but it
Mhm.
sounds like that those are some earned fears, like they have been perceived as aggressive just by questioning an expert. And so
Mhm.
that's something that I that is interesting to hear about, and then having the conference where you can ask those questions, and they are encouraged to ask questions without
Mhm.
judgment on being an aggressive person. And so then the other thing is you talking about discipline with the African American community. That is that something that you see nationwide, worldwide?
It's a conversation that we have internally in the community, and it's a conversation that's perceived in the community. So those are areas that there's traditional approach, and as generation move to the next generation, you talk about that. But I'm gonna say this to you. What I think is real interesting that the conference allowed to do. There was a someone who was speaking. There was a professor was from one of our universities who was at the African American conference, right? And he was in one of the sessions, a professor, and he actually stood up and says in this room, saying that he has African American students in his classroom and they're quiet, and he would like for them to be much more engaged in the conversation, right? And
Mm-hmm.
he says, is there any ideas or tips that points that you can give me that maybe I can get them more to participate?
Mm-hmm.
Well, an arrogant person would have said to him, well, you should know how to do it. You're the professor.
Mm-hmm.
That's what an arrogant and an ignorant person would have said, right?
Mm-hmm.
Arrogant and ignorant. Did you know him asking that question? The feedback that I got, he got more responses from the panel and from the audience. Just
Mm-hmm.
get him some tidbits on how maybe he can engage him a little bit better. Okay.
Mhm.
So that's
What were they? What were the tidbits?
well, just I wasn't there and I got the second hand, but he gave me little tidbits. And that was amazing. And the feedback I got is that he thanked everybody and he was going to take that information back. But I thought that was interesting that remember we said moving from a safe space to a brave space, because
Mm-hmm.
Mhm.
he, as I said to you, some people in that room, if it wasn't the African American or some other conference, or could have happened there, is saying, well, you should know. You have the opinion. You should know. You should know how to work with kids.
Mm-hmm.
But no, he asked that question. And when he
Mhm.
asked that question in a room full of African American, it was sincere, and it was taken as sincere, and he was asking for help.
Mhm.
He didn't know everything, but is there something that can make me be a better teacher? And so that's how that was perceived,
That's great.
not his ignorance, but that's how it was perceived in the community. So that's the thing that's really important,
Yeah, that's
um,
great.
that you have. So I think I don't, and I always like to say this, I don't speak on behalf of all African Americans, right?
Sure.
I just come here to give you a little tidbit of
Mhm.
what we're trying to do to help professionals, um, meet the needs of our community. And if they meet the needs of our community, those things would, apply to most other communities. We would hope, right?
Right.
We would
Right.
hope.
So,
Go ahead.
Ronaldo, our I think there's probably a lot of our listeners listening to you today that say, okay, this sounds like a good conference. I am really interested and excited. And a lot of the listeners are therapists or
Mhm.
parents and teachers working with generally, like birth to 21, but others too, but kind of in the school system. So what would you say are some guiding principles that we'd need to consider when approaching a family with a culture different from our own? Like you said, you're not going to speak for all Black people, right? But
Mhm.
there are guiding principles like listening. And if somebody steps up and says, I have a question about this, that,
Mhm.
you know, we're allowing that.
It's really, I mean, those skills should be applied to all families, number one,
Mhm.
right? So there's
Right.
no specialty with parents of color.
Mhm.
Those should apply to all families, right? But
Right.
also understand families come with their own history, right? So what happens so often I see this is they'll talk about the Latino community, Hispanic community, right? In the United States. Well, if you are an Hispanic community where you've always been in the United States, you live in the foothills, you're making six figures, and or a family just arrived from Guatemala or Mexico, right?
Mhm.
In the United States,
Mhm.
have a whole different look at the world, right?
For sure.
So
Yeah.
Right.
their needs are going to be different, right? There's nothing wrong with that, right? So we all need to just kind of understand that every family has their own history, right?
Mhm.
And their lived experience. And so a lot of times, I always tell people, kind of listen a little bit, just listen. And I think one of the things that if you have like when you meet a new family, hi, my name is Sarah. Hi, my name is Brenda. I'm here to as a team, us working as a team, right? I don't have all the answers. I would like for us to work. I'd like to get your input on what you think your baby needs. Where do you see your baby at, right? Get there
Mhm.
rather than you tell them what you're gonna do,
Right.
them a little bit. This is things that may have trained in school, but ask them, what do you see? How do you see your baby doing? And you kind of work with them from that perspective. Okay.
Mhm.
Mhm.
What do you see? What do you think is the most important? Okay. With your
Mhm.
baby and what your baby needs. Is there, and so what are some of the things that you see you might be having some challenges that I can help you in, and things of that nature. So it's just a matter of getting that family history, kind of finding out what they want before you move forward with the plan.
Mhm.
Mhm.
Some cultures, before you do business, right? Before you do business, you get to know people.
Right.
Mhm.
Some cultures, you sit down, and you eat with people, right?
Mhm.
And so I'm not saying you have to eat with people, but just kind of
Right.
understand, um, if there's common threads,
Right.
um, and try to get those common threads.
Yeah, I think if we go in with an agenda, like a clinical agenda, I'm here and I have this much time to give you this information or assess your child on this skill set, or then we've already missed the opportunity to ask the key question that you just said, which is basically what's your pain point? Like what's hard for you? Because
Mhm,
I'm actually here to serve you.
mhm,
I'm not actually here to complete a speech evaluation. I'm actually here to serve you.
mhm,
And in order to even understand in particular communication, right?
mhm.
I need to know how your family operates. I need
Mhm.
to know how your family communicates in general.
I mean, a good example. So you're doing a speech and language eval, right? And so you say, okay, well, and you're working with the family. So you have mom, dad, grandma, right, grandpa, right? Well, we want to work on grandma, we want to grandpa. Well, that family may not refer to that person as grandma. They may refer to him as what? Big mama, right?
Mhm.
Big mama, right?
Okay.
Now, in the family, we laughing, but in the family, they don't say grandma,
Yeah.
Mhm.
or granddad. They may call him grandpa. So your
Right.
therapist might want to work on not saying grandfather. You might want to just say grandpa. You know, th-
Right.
those types of
Right.
things with I mean, I just gave you an example. It's just a
Mhm.
matter of trying to find those little nuggets
Right.
that developing trust. It's about developing trust, see you as
Hmm.
Mhm.
an ally for the family, and things of that nature. And so those are just kind of some of my. I'm not, expert on culture competent, but these are some things based on my experience that I
Hmm.
see that's been real helpful at the conference.
Yeah.
that
Well,
that's all
one
about
of
a
the
safe place. Go ahead.
yeah, one of the things I
Mhm.
do, most of my services, by the way, are provided in the home. I think you and I talked
Hmm.
about this prior, but first of all, recognizing that just being invited into someone's home is a privilege and
Hmm.
not a right,
Hmm.
there's approaching that way. But one of the things I do when I'm setting up a communication device is I try to do the people page for exactly what you're saying, because I
Hmm.
want to know who are the people
Hmm.
that make this kid's world go round, right?
Hmm.
And I have gotten used to saying, and what do you call grandma? Because it's Mima and Papa and Nini
Hmm.
and
Pawpaw,
all
yeah.
kinds of
Hmm.
names, right? I
Hmm.
mean, the number of people that actually call them, grandmother is zero.
Hmm.
But you know what I mean? So,
Hmm.
but then when you get going with, do you have a photo? Because we want to add their picture to the communication device. Then they do start talking about, well, she actually lives here. Right. And you're like, oh, okay, this is a generation family living situation. Like you don't know that sitting in their living room the first time necessarily.
Hmm.
Right. So one thing in the AAC devices doing the people page first is getting to know. And I think if you're a school-based speech pathologist, you're thinking, how am I going to do that? I'm not in their home. I only see these
Hmm.
family and IEPs once a month, once a year. And you do have to go, hey, I want to reach out to this family now. And I want your student, your child to be able to talk about their people at school. And
Hmm.
the only way to do that is to have those people in your device. And that opens up a conversation about who is important. And it makes it
Hmm.
more person centered
Hmm.
than vocabulary centered or data centered or anything else to that for that matter. And it pretty much requires communication with the family. And so they feel needed in the
Hmm.
development of their child's communication device system because you don't know who all the people are and you don't have the photos and you are an expert on your child. You are the one that has the
Hmm.
most comprehensive view of your child than me. I'm only looking at this small percentage of their communication skills, or which is just a small piece of this body, right? This human. And you have known this human their whole life, and you have usually, unless there's foster or other things going on. But I think that that's a great example, that Big Mama thing, where it's
Oh
just
yeah, Big Mom,
it
and
just
also,
it triggered that memory of mine of that is such a great place to start. And I'm here to serve you. I know how to edit the device. That's scary for you, but for right now, I want to add your people, and you meet them halfway.
and that's really one of the most important things is developing that relationship, and because you know, without trust and respect, the child won't really benefit from your services. You can go in and do, and they're like, I'm glad she's gone, you know,
Yeah,
and
Mhm.
and and the work that you're doing is not being carried out.
right.
So that means trust with the family. They see you as an ally. They see you truly there. You're not there just for a check. Um, and so those are the things. But like I said, the African American community is very broad, very broad. I'm just giving you some generalizations. Um, some things that I said apply to many African Americans, some don't.
Mhm.
But this is just to give you a sense of it's a very diverse community, um, urban and rural. The model in the urban core does not work with folks in rural communities, and oftentimes we see a lot of TV shows showing the gritty urban cities where more than half of African Americans live in rural America, and they have a whole different approach. Okay. Uh,
Mhm.
and so if you're in New York City, talking about a subway may mean something. But if you live in rural parts of Georgia and Mississippi, where families might be doing crop work or farming
Mhm.
work or, smaller community work, they may have a much more different approach. So I just want everybody to realize that it's not just the urban core model. I
Mhm.
was born and raised in rural Arizona. I lived in Phoenix for my adult life, but I grew up in rural Arizona, and as an African American, okay, I knew about horses, cattle, copper, and citrus.
Right.
Yeah.
So
Yeah.
so
Good
people
perspective.
are surprised that people are surprised that.
Yeah.
My first subway, I think I was 1985. I rode on my first subway in New York City. when I went to New York. Never been on one,
Mhm.
Right.
But I rode a
Yeah.
horse. I rode a horse,
Right.
rode a horse. And one of the things with the African American community, traditionally we always talk about South Phoenix, but Phoenix is one of, if you think about it, if you guys look at statistics, I think Arizona and Texas are the two main states where African Americans are moving from California to Arizona,
Mhm.
right? Moving to Arizona. And so even though our numbers are not large, we're probably one of the highest percentage increases in Arizona in
Okay.
terms of African Americans coming to Arizona. And many of those African Americans are, professionals, working folks who moving from California for a lot of reasons, housing, economics, better life, slow things down as they get older with their kids or whatever. So,
Mhm.
the community is all over the valley. I mean, the west side, the east side,
Right.
traditional South Phoenix, um, but the communities all over the valley, um, things of that nature. We have old communities in, Sierra Vista, Casa Grande, out of Pinal County. So we have these different communities, but I think the main thing, what I would say, this to you is, as you talk about these different communities, um, a lot of these communities right now, especially with the rhetoric in this country,
Mhm.
got a little more closer eye on folks coming into their home now
Mhm.
because of the elevated um, nonsense that's going on. And when you do outreach to different communities, like I said, different communities, Native communities, we have, I think, 21 recognized federal tribes in Arizona.
Mhm.
And I just was up on the Navajo Nation not that long ago. They have a great program, Growing with Beauty, that with early intervention. Um, so we have those different communities. We have a large, rural community in Arizona.
Right.
So mining communities like Morenci. And so they have their own tight-knit culture and globe, things
Mhm.
of that nature. But when you go into those communities, you just have to kind of understand they do things a little bit different. You bring
Mhm.
your template there, but you also have an underlay that there are local implications as we do our work in this area. So those are the things I think that would be real helpful. But as I mentioned to you earlier, we have the virtual conference coming up in February 14 and 15. We're going to be in person at the Hyatt Regency. Brent, I can share that information with you. You can share
Yeah.
it with your
And we'll
group.
post it for sure.
Um, I think it's going to be really nice. I've confirmed with a couple moms who are going to talk about um, raising a child with a lot of health issues, with a lot of
That's great.
medical issues, and they're going to talk about developing advocacy skills and what it took. And so they're going to be talking from parent to parent. Okay.
That's wonderful. Renaldo, I was actually going to ask you about that piece of it. What have you heard from your conferences about families and advocacy and how that might look in schools and how they can be part of how how teachers and therapists can help include families of all
Well,
cultures more?
yeah,
But
I think one of the things, there's a couple of things. One of the things that was really nice, I received an email from one of the leaders of the Arizona Division of Developmental Disabilities, and they sent many staff members to the conference, and I got a nice response back from him saying that the information that he received from his staff was very positive, but he said something that was important, was that he hoped that they utilize what they learned in the conference in their practice of working with families. Okay.
Mhm.
Mhm.
So that's one of the things that that was really important. One of the things that we try to do, it's not as been successful, is we do invite schools and we reach out to schools, and we don't get as much participation from school systems like I think we should.
Mm.
I think it's sad because we do an education track. Um, we're an advocacy organization, but
Right.
we do an education track. Um, but we don't get that response like we should. We get some schools, don't get me wrong, we get some schools to come, In the past, several schools have come, but we would like to have more schools there, especially schools that serve students of color. I've been probably more disappointed in those schools than other schools. I think I get sometimes more schools from the suburbs come to the conference.
Right.
So that's one of the downsides of it. But we're going to be here at the conference. We're going to continue to have those brave conversations at the conference. They're meant to be brave. They're meant to try to make changes, try to improve situations. But I think the most nice thing about it is I hope we're offering a safe place for families, professionals to have that honest dialogue and meet our families. There's no gatekeepers. You're hearing directly from our parents. Yeah, you're going to hear it straight from the parents, uncensored.
Excellent.
What's going well,
Yeah.
what's not going well.
That's
And
great.
it sounds like there is a similar, not that's doing a conference, but a similar organization to what you are in every state. Is that right?
There is actually a protection and advocacy agency in every state. Okay. And what they do is depend on that state. We have the African American Conference. That's one of our projects. We do everything they do. Okay. Some do special ed, mental health, employment rights, housing, abuse and neglect, mental health.
No matter where you are in the United States, there is this division in your
there's
state.
a disability rights organization. Disability rights New York, disability rights Arizona, Florida. They're there. However, the law firm that I work for, this is one of our projects. We have many projects. This is one of the projects that I lead. So they may not do this because they may have other priorities in their state. And so you really have to reach out to Disability Rights Washington, okay? And find out what they do in their states, things of that nature, because each state is different on how they meet the needs of their populations.
Right. But it sounds like you're open to helping states kind of replicate in a way what you're doing, or join in and learn from it.
We've actually had other presenters from our other protection and advocacy organizations participate in the conference. Okay, so we do this. We're inclusive. To answer your question, I speak to many different organizations every week, especially around now. When we do the virtual, next week we're going to do the virtual, it's open for the virtual conference. I guarantee you I would get more emails and more phone calls from different states, different organizations about the conference. When we do the in-person one, I would get tons and tons. And the answer is yes. I've worked with different states. As I mentioned to you earlier, I was talking to folks out of Virginia and New York last Friday on getting an event, one-day event going on in that state and things of that nature. And so, we're here. It's all about meeting the needs of families. This is not a propriety type of thing. My goal is to make sure all families, if they're African American, Native American, low income, that their families get the needs and services that they need, that they're entitled to, and that we provide them a platform where they can come and learn. It's all about learning. We don't sell anything at our conference. It's all about learning, empowering yourself, giving you some extra tools in a toolbox. So go advocate for services for your child, family members, resources that you may need.
Well, thank you for doing what you're doing. Thank everyone at your organization for the vision that you've had. Thank you for, I love that your background is in special education. And I want to thank you for sticking with it for the 4 decades to watch it turn into something, because, you can get an idea and try to do something and it doesn't, you don't have, you don't have 15 countries involved right off the bat, right? You just kind of have to keep plotting away. When it's the right thing for families, I think that's what needs to be driving all conversations. And so I really appreciate the example that you've set here. So thank you so much for your work.
Well, thank you, Sarah and Brenda. I really appreciate the opportunity to speak with your group. And Brenda, I will share the information about the conference so you can get that out to your group. We would love to have you guys come there, and in the future, maybe we'll have something about occupational and speech therapy at the conference presentation.
Sounds
Okay.
good. Thanks
Sounds
so
good.
much for joining us. We'll look forward to the information.
Thank you much.
Thank
Have
you.
a good day.
Bye.